Good morning to all who are here today. I am delighted to welcome all of you to this crucial collaborative training event. I particularly wish to acknowledge the presence of Dr. Renata Clark, the Sub-Regional Coordinator for Food and Agricultural Organization, Dr. Isabel Granderson, the Principal Investigator for the University of the West Indies, and Dr. Ruth Sharon Deere, Nutrition Officer for Latin America and the Caribbean, Santiago, Chile. On behalf of the Ministry of Health, I extend sincere thanks for your participation and facilitation of this very important and timely workshop. I am informed that this activity signifies the commencement of a one-week training exercise for data collectors and field supervisors who will engage in the individual food consumption survey and analysis in St. Kitts Nevis, which is scheduled to be conducted over the period November to December 2020. The Ministry of Health is therefore grateful to these essential trainees who have consented to officiate in the upcoming survey. The survey project is of immense significance to St. Kitts and Nevis and will emanate in far-reaching implications because currently within the Federation there is a high number of persons with chronic non-communicable diseases comprising of some 83% of the country's overall death rate. In addition, the results of the survey will provide crucial and critical evidence regarding the Federation's progress to adopt the United Nations SDG number 2, End Hunger, achieve food security, and improve nutrition and promote sustainable agriculture. I am further informed that in an effort to mitigate against the incidence of the non-communicable disease and accelerate our progress toward the target goals, the survey will, 1, ascertain the size and nature of groups that are at risk of inadequate or excessive intake of energy and nutrients, be useful in the development and evaluation of health and sustainable food-based dietary guidelines for the Federation of St. Kitts and Nevis at the individual level. 3, provide dietary data that can be used to garner a better understanding of typical household food preparation, cooking methods, and brand names of foods consumed within the household. 4, examine linkages between income levels and dietary choices, as well as dietary pattern and health outcomes. And 5, it will serve as the basis to develop relevant food-related national programs and policies with the overall aim of reducing malnutrition and chronic non-communicable diseases. The ministry is well aware that poor or unhealthy diets are causing micronutrient deficiencies and malnutrition. Moreover, our society is reeling from an unfolding obesity epidemic, a key contributing factor of associated non-communicable diseases. Thus, the Ministry of Health will intensify all efforts to promote appropriate nutrition and reduce the modifiable predisposing factors for non-communicable diseases as one of its strategic priorities. Hence, this survey is quite timely and relevant as an essential instrument to assist the Federation in tracking its progress. Because despite the critical importance of healthy diets to our health and well-being, we are challenged in getting reliable data on what our citizens are eating at an individual level. Therefore, appropriately assessing the nutritional adequacy of diets of different population groups such as children, pregnant and lactating women, and the elderly, and all our citizens to that matter, is important to estimate food consumption and ascertain the degree of risk for malnutrition at the individual level. I therefore wish to take this opportunity to commend the Food and Agriculture Organization for this initiative and to thank the University of the West Indies for its collaborative support. Again, I extend the ministry's gratitude to the participants of this training workshop, who will not only gain a new skill in data gathering, but would also provide the Federation with a new cadre of data collection personnel and capacity. I certainly look forward with much enthusiasm to the successful conclusion of this training and the subsequent implementation of the first national individual food consumption survey in St. Kitts and Nevis. I wish you all the best in your course, and I pray that you will continue to use that to help us at the Ministry of Health to be able to determine what's best for us in terms of nutrition. And I hope you'll take the information that you gather and make changes within your own household and your families as well, because that will be important. I'm sorry I won't be here until the end of today's proceedings, but I wish it all the best, and I wish all of you all success in this training, and I'm looking forward to the work that you would be doing in terms of the survey and the outcome of that survey, because I know in particular Ms. Duncan would be happy to know how do we move forward with ensuring that the nutrition in St. Kitts and Nevis is where we need it to be. So once again, thank you and have a great training.